Okay, hi, Assalamualaikum. My name is Sharifah and my other two members, which is Haikal and Khalid. We are going to present on the exercise recommendation for asthma in children. So based on the evidence itself, we decided to choose aerobic exercise as one of the exercise recommendation for childhood in asthma. Before we proceed to the exercise prescription itself, macam biasalah mana-mana exercise program pun it's going to start with the pre-participation screening. So next. Alright, ni so initially participant will undergo this pre-participation health screening in order to identify their information on health status. Cara dia melalui self-report questionnaire and also objective assessment based on the ACSM guidelines ataupun macam doktor cakap PAQ Plus screening. So in this asthma program, we decided to choose PAQ Plus questionnaire as one of the screening tools which has 7 main questions regarding their medical concerns and also condition. So it is actually designed to determine whether individuals are able to be physically more active and engage in the fitness appraisal. So there beza PAQ dengan PAQ Plus. PAQ Plus dia ada penambahan dari segi follow up questions yang macam Dr. present tadi. So in this follow up section, dia lagi spesifik untuk certain medical question, medical condition lah. So macam contohnya cardiovascular disease ataupun metabolic disorder. Tapi untuk asthma patients, we specific on the question number 7, which is section number 7, menekankan tentang respiratory disease, especially untuk asthma children lah. And this question selalunya akan ditanya based on the symptoms of the condition itself. So cara nak evaluate each questions patients akan take berdasarkan ada simptom ataupun tidak. So untuk scoring, if patients responds positively yes to 1 or 2 questions, that means they have risk to be physically inactive, which means they need to further informations ataupun consultation under the physician before they can physically be active in the exercise program. But if the participants answer no to all of the questions, that means they are readily be access to the physical activity and they can start slowly and gradually to the exercise program. So next. Next slide. Okay, so PAQ Plus saja tak cukup, jadi we add on medical history and also evaluation. So this previous slide. Okay, patient with asthma should be risk stratified based on their history. So this thorough history is very important in order to identify underlying
slide ni kan?
Tak sebelum ni.
Okay dah?
Sekejap.
Medical history lah?
Sekarang dekat peak flow rate. Cuba buka. Tak, cuba buka medical history.
Okay, dah.
Okay. Thank you. So this So thorough history is important to identify an individual's underlying medical condition, their risk factor, and also untuk kita identify their severity in asthma condition, which may be interfere with their participation in exercise program. So apa yang kita check adalah basically subjective assessment of their personal history and also family history. Sekiranya patient tu sendiri ada history kalau dia punya family ataupun parents have developed asthma. So next, we also need to identify if the individuals have relation to any asthma triggers, especially untuk specific asthma condition yang dipanggil exercise induced bronchoconstriction, EIB, which is exercise tu sendiri menggalakkan lagi condition asma sekiranya dibuat secara high intensity. So we need to jot down lah on their exposure to any triggers, irritants or allergies. Contohnya macam environmental factors seperti cold weather ataupun cold air, which is lagi trigger dia punya asma tu. And then we also need to record on the prescription of medication use. Contohnya macam rescue inhaler such as bronchodilator ataupun anti-inflammatory medicine. So for the next assessment is on the objective, which we need to identify on their presentation about respiratory symptom. We need to record a few types of observation in asthma in children, such as wheezing, coughing, breathlessness, chest tightness. So if the individuals who has actively wheezing, they should be restricted from participation until their symptoms subside. So we need to also assess for BP, heart rate maximum, respiratory rate, saturation oxygens, and also PEF, which is peak flow meter. Macam dalam table ni is the normal value for according to the age and also severity of asthma condition. And next, assessment of body mass index, which is BMI, also is required if patients has related to the comorbidities such as obese individuals. And lastly, we need to assess for Borg RPE scale, which is rating perceived exertion, ataupun another outcome measure yang boleh guna adalah perceived exertion scale. To check for any physical exertion ataupun kadar kepenatan in individuals tu, especially untuk EIB asthma patient. So well-controlled asthma who present with a symptomatic at rest ataupun without any exertion, they can be safely cleared after the pre-participation screening. Okay, dah. Saya pass kepada team member yang lain.
Next. Okay, next kita pergi peak expiratory flow rate. So ni ramai mungkin dah tahu. So PEFR is the maximum rate of flow of forced expiration after full inspiration to total lung capacity. So peak flow meter ni dia portable, inexpensive and easy to use. Instruction dia, first ensure correctly fit mouthpiece is used. Second, make sure the indicator is at 0. Third, stand or sit up straight. Fourth, take a deep breath in and hold it. Fifth, place the mouthpiece in your mouth and close your lips around it to make it seal. Okay, lepas tu next, blow out as hard and as fast as possible. 7, remove the meter and breathe normally and note the number that appears on the meter. And repeat for a total of 3 times. Okay, next. Next. Okay, so ni scoring dia, green zone 80 to 100% of flow rate. So condition is under, next, belakang. Wait. Okay, so kalau green zone under control and ideal, so boleh continue untuk exercise lah. Tu tak habis lagi.
Ya.
Belakang.
Ni.
Okay, yellow zone 50 to 80% of flow rate. Airways maybe starting to narrow. Top.
Ni.
Belum.
Tak tadi. Belakang ni.
Tadi kotak ni.
Ya, dah ni kotak.
Tak.
Kotak. Aku tengok mana kotak ni.
Okay.
Dah. Boleh lambat kan?
Okay, yellow zone, airways may be starting to narrow. Talk to your doctor about how to handle yellow zone results. Now lastly, red zone less than 50% of flow rate. Airways are severely narrowing. Take your rescue medication and contact emergency services. So kalau ni tak boleh proceed untuk exercise lah. Okay, next.
Dia tunggu ni. Childhood asthma.
Ya. Okay, lepas tu outcome measure yang boleh guna ialah childhood asthma control test. So childhood asthma control test ni ialah self-administered tool to assess asthma control in children aged 4 to 11 for the past 4 weeks. So there are 7 items, 4 to be filled by the child and 3 by caregiver. So total score dia ialah 27. Less than 19 indicate poor asthma control. So validity dia ada strong correlation with other asthma assessment tools. Lepas tu ada good internal consistency and good test retest reliability. Lepas tu responsiveness dia MCID ialah score change of 2 points. Okay, next.
Okay. Alright. Next, for the next outcome measure, we plan to include 2 more outcome measure, which are the spirometer test and stat test. Masalah sekarang ni ada sedikit clash tentang planning ni, so mungkin kita skip dulu. Next kita berikan exercise prescription FITT untuk frequency. We plan to do the exercise session for 3 to 4 times per week. For intensity, moderate intensity with the speed based on patient pace. We use the top test method to monitor subject conditions. And target time 30 minutes per exercise session. Multiple repetition until desired time target. Progress time based on children performance. So before 30-minute exercise session, we will conduct 5-minute warming up, and after exercise session, we will conduct a 5-minute cool down session. And next, the type of exercise that we choose for our exercise prescription is circuit aerobic exercise. Start with football dribbling, and next passing the ball, and basketball dribbling, and 4-point hopping. Okay. 1 full rotation described as 1 repetition. Okay, for the next slide, I will show you on how the exercise being conducted lah. So as we can see here, it's a 2-way line with start and end at one end. Okay, so for first checkpoint, football dribbling, the children need to dribble a ball from point A to point B. After sampai dekat checkpoint B, dia akan baling bola ke assistant dan akan terima bola lain, iaitu bola keranjang lah. Daripada point B akan patah balik ke point A dengan aktiviti basketball dribbling lah. Okay. And next, dekat checkpoint D, dia akan buat 4-point jump. There's 4 point and the student need to hopping from A to B to C to D. Okay, this cycle will repeat until sampai 30 minit target time. And next, that is our aerobic exercise prescription. Okay, so for safety precaution, wear proper attire, take necessary medication beforehand and prepare inhaler or any medication that prescribed to the patient. Ensure the safety of the location, stop if there are any symptom. Common injuries, muscle strain, muscle cramp, and sprain due to fall. Don't high intensity exercise, pushing too hard, and cold weather. Next, complication. Okay. During the exercise, the children may have fatigue, short of breath, dehydration, and exercise-induced bronchoconstriction. Okay, so how to overcome it? Proper cool down technique, breathing exercise, consume enough water, warm up before exercise to induce refractory period and pre-medication. And also for EAB, the children need to take their meds, their inhalation meds. So the barriers is the lack of motivation, fear of asthma attack, and time limitation. How to overcome it? Make exercise enjoyable, incorporate music, and provide incentive. For this one, we plan to put assistant at both end A and B to give voice motivation. And next, for a fear of asthma attack, parent and we will give parent and child education on the importance of exercise on children with asthma. Next is time limitation. How to overcome it? We will try to make the exercise shorter but enjoyable. Okay. I think that's all for our exercise prescription. Profesor Maria, kami dah siap.
Okay,